Dear students, welcome back. In this session, we are going to discuss about the colon. In the previous session, we have discussed about cecum and appendix. Okay, now we are going to discuss about the colon. Colon is the part of the large intestine which extends from the cecum, in the right iliac fossa. Okay, and to the rectosigmoid junction in front of the middle of the sacrum. Rectosigmoid junction in front of the middle of the sacrum. So this part is present in front of the middle of the sacrum. Okay, it is arranged in the form of inverted U shape. And within its cavity, the coils of small intestine are situated here. Okay, so this is the extent of colon. Now, we'll see the subdivisions of this colon. It is divided into ascending colon. So this one is ascending colon. And this ascending colon, which ascends up from cecum to the inferior surface of the right lobe of the liver. So this part is present inferior surface of the right lobe of the liver, where it makes a sharp bend called the right colic or hepatic flexure. Why it is called hepatic flexure means it is related to the inferior surface of the right lobe. So right lobe of the liver. Okay. And then the transverse colon. So this is about the ascending colon. The transverse colon, which extends from the right colic flexure to the splenic flexure. So this one is the splenic flexure or the left colic flexure. This one is called as left colic flexure. Okay, which is situated below the lateral end of the spleen, which is related to the lateral end of the spleen. The splenic flexure is located in the hypochondrial region. So on the left hypochondrium region, this left colic flexure is present. This is the left hypochondrium region. Okay. And the splenic flexure, so the splenic flexure is located a higher level than the hepatic flexure. Splenic flexure is at higher level than the hepatic flexure. Okay, now we'll see the descending colon. The descending colon descends vertically downwards from splenic flexure to the iliac crest, from where it curves downwards and medially towards the pelvic brim. Okay. Next one is the sigmoid or pelvic colon, consists of large intestine suspended by mesentery, which is attached to the posterior wall of the pelvis along an inverted V-shaped line. So this is called as sigmoid colon or pelvic colon. So this part. Okay, the apex of the V attachment is at the bifurcation of the left common iliac artery and overlies the left ureter. There is often a peritoneal recesses here called as the intersigmoid recesses is present. The sigmoid colon extends up to the front of the third piece of the sacrum, which will extend up to the third piece of the sacrum. Okay, so this is about the what you call as pelvic colon or sigmoid colon. Okay, Now, if you see the lengths of all these parts of the colon, so the ascending colon constitutes 15 centimeters and descending colon constitutes 25 centimeters. Transverse colon constitutes 50 centimeters and sigmoid colon is about 40 centimeters. So these are the lengths of all these divisions of colon. If you see the blood supply, okay, blood supply, the ascending colon, okay, ascending colon, hepatic flexure, and the transverse colon are supplied by the ileocolic, okay, so ileocolic and right colic and middle colic, right colic and middle colic branches of the superior mesenteric artery. This is the superior mesenteric artery which supplies the ascending colon, okay, hepatic flexure. So this one is hepatic flexure and transverse colon. Okay, the rest of the colon is supplied by the inferior mesenteric artery, branches of inferior mesenteric artery. The branches of inferior mesenteric artery are the ascending branch of left colic artery and then the descending branch of the left colic arteries. So this will supply the remaining part of the colon. Okay. Here the various branches divide and anastomose and form a continuous arterial chain near the colon called as marginal artery of the colon, from which a number of straight branches arise to supply the colon. The marginal artery is weak where the lower colic branch of inferior mesenteric and the first branch of superior rectal artery. So this one is the superior rectal artery meet called as Sudex point. Veins of the colon drain into the portal system. So the corresponding veins of these arteries will drain into the portal system. If you see the nerve supply, the autonomic flexus of nerves accompanies these arteries. It contains both sympathetic fibers as well as the parasympathetic. So the sympathetic fibers from T11 to 12 segments of the spinal cord will supply the sympathetics, whereas the parasympathetic fibers from the vagi, so both right and left vagi. And also the parasympathetic, not only the vagi and also the sacral splanchnics of S2, S3 and S4 will supply to the colon. Okay. The sacral parasympathetic fibers supply the part of the colon supplied by the inferior mesenteric artery. Okay. So only the sacral parasympathetic fibers supply only the fibers, the arteries which are supplied by this inferior mesenteric artery. If you see the lymphatic drainage, the lymph vessels follow the blood vessels in a retrograde direction, that means in a reverse direction, a retrograde direction, and end in the superior mesenteric and inferior mesenteric nodes. So these are all about the colon. Thank you.